Hey, so you have to forgive the way that I look and that I sound. I'm very sick. Been running a fever since Wednesday, coughing, heaviness in my chest. Um, Con visited this weekend. By Sunday, Waylon was sick, running a fever, and he has been sick ever since. As most of y'all know who follow me, you guys are aware that the facility has been pushing for months now to send my extremely unstable, mentally challenged son home. They are basically saying that he needs a much higher level of care than where he's at. He's in a level 2. They have a level 3 and a PRTF on campus, but conveniently don't have any openings. We've been trying for 3 months to find a level 3 that will accept him, and he's been denied numerous times due to aggressive behavior. So this facility has now decided that they don't care anymore, and they're just going to send him home to me. And I've been going back and forth for weeks now, battling this, because with him coming home, I have zero supports. I don't have med management. I don't have therapy in place. The day treatment, it's still touch and go as far as if day treatment's even going to be available, if they have an opening. Just a lot of things that are not put into place for him, for his supports. I've been doing this for 15 years. I've been in and out of many, many facilities, and had countless services come into our home. We've gone to them. He's been in and out of facilities since he was 9. His current mental state is unstable. He's unstable. A violent act just recently, as of last week. And this facility has decided that regardless of us not being able to find level 3 and his violent tendencies, that he's going to come home anyways. Yesterday, I got a phone call from the facility, and due to COVID, or the coronavirus, whatever you want to call it, they've decided that they're sending all of their children who are in the level 2 and the level 3 home. If they have homes to go to, they're sending them home, which means that Con was coming home. And so I basically got pushed into this ACT service. It's a service kind of like intensive in-home or FCT, which we've had numerous times, but they previously denied us because they knew that Con's needs were going to be higher than what they could provide assistance with us for. For those of you that don't know, my son, he's a baby doll, he's a sweetheart, and he's trying really, really hard, but he's sick. He can go from 0 to 1,000 in 2.5 seconds, and there's really nothing you can do. In this 1,000 is when he gets very violent. He will use weapons. He will use whatever he can get his hands on at that moment. And he will be in crisis, and sometimes those crises last 45 minutes. Sometimes they last hours. It really just depends on the situation. So the facility texted me today. They text me, okay, to let me know that they now have 3 employees at that facility who are being tested and are suspected of having corona or COVID. It is now 6:30, and I still don't have confirmation one way or the other of whether they have it or not. Now, don't get me wrong. Yes, I'm sick. Yes, Waylon's sick. Con was running a fever on Tuesday. I'm not sitting here saying that we have corona. I mean, I'm not. Please understand that. But at the same time, this just goes to show you the amount of negligence that is going on with this facility. I'm so livid at this point. I mean, I don't feel good. I'm running a fever, and I'm having to handle all this and this back and forth with the emails and all of that stuff. Meanwhile, I'm having to work out, having somebody go get my son because they told me he has to be picked up today. if I refuse, I did speak to a DJJ worker about if I refused to pick him up due to my fear of what he possibly could do while he was home, and just how unstable he is. And basically I was told that I would be charged with neglect, that he would be picked up by DSS, and that basically the judge would basically then force me to come get him, or I would go to jail. So that's not an option. So at this point, this facility is like trying to send me all this paperwork to sign, which is his PCP, his CFT, and his discharge summary. And they're trying to get me to sign all of this documentation. And to me, it seems a little fishy because this lady sent me the 9 or so documents of the signature pages of each one of these types of packets or forms to fill out. And I have done this for so long that I know what each one of these are supposed to look like. So for her to just send me the signature pages only just seemed very odd to me. It just seems very fishy to me. So I have advised my care coordinator through Partners, who's been privy to all of the mishandlings and all of everything that's been going on, a text message. And I just basically said, look, I'm not signing nothing. And I won't. I've had that bite me in the butt in the past. Until I review these documents and what they are saying discharge-wise, I'm not signing shit. So, I don't know. This is mainly me just venting. But this is messed up. This is so messed up. And I plan to very much send this to the Department of Human Health and Services just to let them know kind of what's going on. You know, they suspect that there is people at this facility who could possibly have corona, and their plan, their precautions, instead of going into quarantine until they get confirmation one way or the other, is to send all of these kids home. Now, my heart is aching not only for my own situation, which is scary as crap. Okay, I'm petrified at this point. But some of these kids, their home environment is the reason that they're there. Not all of them. Now, don't get me wrong. And some of these kids have nowhere to go. They have nowhere to go. And, you know, I kind of asked about that. I was like, well, what about these kids that don't have, excuse me, don't have anywhere to go? And they said that they are trying to work with DSS to find them like foster cares and stuff like that. But I've received phone calls over the last couple of days. DJJ's not making any house calls. DSS isn't making any house calls. Everybody's doing everything from home, remotely. A lot of these facilities aren't even accepting any of these kids. On top of that, these kids are at risk until they get the results back from these 3 employees that could possibly have it. These kids are already at risk that they have been in contact with it, and could be potentially spreading it. So, I mean, this whole situation is just a nightmare, and it's ridiculous, and I just needed to explain. And again, I'm sorry I sound like this and that I look like this, but I feel like crap, if we're being real honest. There's nothing I can do. There's nothing that anybody can do as far as I know at this point. It's just messed up. It's messed up. So, I mean, I'm hoping that I will post this and that I will be tagging the Department of Health and Human Services. They're all probably working from home. But at this point, this is not only am I dealing with the dangers of my son coming home, who's extremely mentally unstable, with no therapy, no med management, no crisis prevention plan, nothing. But on top of that, he could have been exposed to this virus, and we may already have been exposed to it. So if you watched all of this, thank you. I don't know, guys. It's messed up. This is so messed up. Pray for me. Pray for Con. Pray for the other kids in this facility. I mean, I know everybody is affected by this. Not trying to say that I'm affected more so than anybody else, but when this whole thing happened, I never in a million years thought that it would be this close to home. I never really thought that it would be a possibility that it would be here, that it would get here. But it also puts everybody else at risk that lives around us. So, I mean, sorry if there's an outbreak here. I apologize, but I mean, my hands are tied at this point. So, love yourselves. Love each other. Thanks for listening to me vent.